Vaginal examination is done in labor monitoring and gynecological exam such as this spectrum or binomial examination. So, or when example, it is mainly done for labor monitoring to see the cervical dilatation. So that is why in the second stage of labor. So it is prohibited where you, for condition for vaginal bleeding like ectopic pregnancy and abortion, for PPROM and PROM refer to uterine contraction, also for infection because you are risking the patient for more infection. So the infection may include the infection like amniotis, like herpes simplex, like condyloma accuminata. So you should prepare as a midwife, and your client and equipment. So you start every procedure by washing hands. So assist the client into a suitable and comfortable position, usually on the back. The main used position for one is going to undergo VE is lithotomy position. 5. Bent and in abduction with the heels joined, then explain the procedure to the client. But after doing VE, make sure bladder is empty. Make sure that the area around the vulva and the vulva are clean. Then we are going to start. You should make sure that the area around the vulva and the vulva itself are clean. They are vulva and the area around it. Should disinfect the vulva and the area around it if necessary. What you do, the aim is to remove waste. So disinfect the vulva and the surrounding either by putting on the non-sterile gloves or with the culture's forceps. So discard the forceps in the solution of the contamination and decontaminate the gloves and throw them. Put on sterile gloves, then lubricate the middle finger and index of the hand which will do the examination. When you are going to do the digital vaginal exam, you use your thumb and the first finger. No, you use the middle and not the thumb, but the middle and the index of the hand. Then observe the labia or for sign of varicose vein. We have two labias. We have labia majora and labia minor. So what you do, you observe the labia for the sign of varicose vein, edema, vulval warts, wounds, genital mutilation, discharge, and any bending from the vagina. Bleeding, because the bleeding digital vaginal examination is prohibited from one who has vaginal bleeding, such as in molar pregnancy, ectopic pregnancy, also abortion. So in the case of ruptured membranes, note the quantity, the color, and the odor of the amniotic liquor. So penetrate the labia minora in the ventral direction with the index and the middle finger of the hand, which is not lab. Then with the index finger and the middle finger of the hand which examine, when you examine, remember that use the index finger and the middle of the finger which examine. Enter the vagina without touching perineum, as it will prevent. Perineum is closely related to anus. It may you do it so as to prevent infection. Avoid applying pressure on the clitoris to prevent sexual arousal and urinary matters. So start the finger. Lubricate the finger when you are going to do the VE. You lubricate the finger, which entering the vagina and following the posterior vaginal wall in the direction of the cervix. Following the posterior vaginal wall in the direction of the cervix. So you see the vagina. You see the vagina. You do the right left. You go in the middle in the U7 until you reach the ring. Until you reach the ring. Then information is collected concerning length of when you are going to do cervical dilation. What do you know? If someone says, what do you notice on cervical on digital vaginal examination, you don't say I notice hotness or coldness in the vagina. I notice the cervical dilatation. Cervical dilatation composite of cervical length of the cervix. I mean effacement of the cervix, if consistent, if it is soft, its localization, if anterior, central or posterior. Cervix may be anterior, may be posterior, or may be in center. Cervix, posterior or in center, and then the length, effacement, then cervix may be soft or hard, may be intact or not. Then other is the dilatation of the cervix. Then site of membrane, if membrane, you see membrane, if ruptured, you see you isn't it in no, notice them in cervic. Then fetal presentation, cephalic, breech, shoulder, knee, hand and foot. Then fetal position, if posterior fontanelle in relationship to the paternal pelvis, then fetal descent to level. Then the information called the evaluation of the pelvis, checklist, pelvic assessment, called prolapse, wounding, placement, previa, and capsicum. So when you are going to do identify different things in your thighs, you go cervix may be soft or hard. Cervix may be effaced or not, and may be anterior, posterior, or in the center. Or so you see that the cervix is the anterior. The cervix is anterior with 2 centimeters, and this cervix is anterior with cervix is anterior, not effaced, and cervical dilatation is with the chart with the fetal presentation of cephalic. Then move the finger from the vagina and discharge is observed for odor, color, and consistency. What is removed from discharge is what removed after doing the vaginal examination. So there are some blood that discharge. You examine it. Its odor, its color, and its consistency. So wash your hand in the solution of the contamination before taking off. Wash the hand before removing gloves. Discard them into the dustbin. Then set the current into comfortable position. Then membrane. If membrane ruptured, evident, stay sanitary pad to apply. Rupture of membrane is like water coming out. Then to explain the result, to turn it to the woman. Then what you explain to the woman? Is what? You tell the woman that you are in the second stage of labor. No, the mother is in the second stage of labor. You tell the mother that your cervix is soft, so your cervix is hard. The baby, is soft. Baby not to get any problems passing through the cervix is hard. The baby not to get problem passing through that cervix, and the position of your